Okay. Am I audible to everyone? Okay, so let me open my chat box option as well so I can read your comments.
Audible.
Audible. Okay, fine. So can someone help me in importing the sheet into the SPSS? Anyone? Who can help me for importing the sheet into the SPSS?
Go to file option.
Yes, file.
Open it.
Then,
You want to select the file SPS class.
but from where? Open a file, then what?
Where the
We need to open the data set. So click on open, then data. Now what? Next thing will
SPSS.
be what? Not SPSS. First thing is very important that we need to search our file where it is located first of all. So it is in my desktop. So I'll go to my desktop file as such of now. I know it is in my SPSS class. Now what? Nothing is coming up. So what we can do now?
Excel type of file.
Yes, Excel. Okay, so everyone please open your statistical analysis class practice sheet. Once done, let me know. Everyone, all done? Can we proceed now?
Give us couple of minutes, sir.
Yes, sure, sure. You can take. Others, please be active. If you don't want to learn, then please leave the class, but please be active in the SPSS sessions. All done? Everyone ready now? Anyone?
Yes, sir.
Okay, what about others now?
Yes, sir.
Done. Only two people are like active today, like today's class. What about others? Like, did you open the sheet or yes or no? Apart from Yashvi and one more, I think Maggie it was. Apart from these two people, all done? Okay, so I'm getting only three responses, so I'm not expecting to repeat anything in between again and again. Okay, now the first thing what we are doing is the chi-square. So chi-square is the test in which we need to find the relation between two objectives. Now suppose I want to find out the relation between diabetic mellitus and the heart condition. So there we can apply what? A chi-square. So remember one more thing, that chi-square will be always applicable if you have data in the categorical format. So if you have data in the continuous variable in the continuous format, then we cannot apply what? A chi-square. So we have to apply what? Sorry, we cannot apply a chi-square, and if you are having data which is in the continuous variable. Now to apply the chi-square, you should be able to learn, you should be able to handle, you should be able to have a data that is in the categorical format. Now if I want to look forward to the relation between the diabetic mellitus or the heart failure or the renal disease or liver disease, so that part we can apply with a chi-square. Now suppose in this class we are having some case and control. So again we are having what? Two categories, that is what? Case and control. The next thing, we can take anything but not the continuous variable. But remember one thing, for the chi-square, we need all the data in the categorical format. Number one rule. Okay, so let me take AKI, varices, PNG, GI bleed, hepatic encephalopathy, peptic ulcer, anything which should be in the categorical format, but not in the continuous variable. Now the question comes, how to apply chi-square by using the SPSS. So what we have to do now, go to analyze, correct? Now go to your descriptive statistics, go to your cross steps. Simple steps. First step is what? Analyze, descriptive, and the cross steps. Simple steps. Analyze, descriptive, and cross steps. All done? Everyone? All done?
Yes, sir.
Yes, sir.
Okay. So why we are applying chi-square? Because we need to find the relation between two things. Now suppose here we are finding the relation between case and control. Or suppose someone asked me, like, do we have any relation between the case group and the occurrence of ascites, or the occurrence of hypertension, or the occurrence of diabetic mellitus? So what we can do, we can find the relation between these two parameters. So how to find? Go to analyze, descriptive statistics, click on cross steps. Now I wanted to check for what case control with some other parameter that should be in what? In the categorical format. Suppose I'm taking total hypertension, diabetic mellitus, SBP, AKI. You can take multiple variables in one shot. So put in the column. Now this will not resolve or not give you the exact test. So what we need to do, we need to go to the statistics part, click on chi-square. Once done, so here we are having multiple relations over there. With the help of all the variables, you can find the odd ratio, risk ratio also. If I click on risk, you will get the odd ratio also. But as such of now, we are just learning about the chi-square test. That's it. So what we can do, just click on chi-square, click on continue. Now go to your cells. Now for reporting data for the research paper, you need some descriptive values as well. You need some percentage, you need some numbers, you need some p-value, correct? Now for this part, always click on expected count as well. I have seen many statisticians, many people are doing mistake by not clicking on the expected count, because expected count less than 5 or equal to 5, we cannot apply chi-square. For that part, we need to apply what? Chi-Fisher test, correct? So always click on expected count as well. Apart from this part, click on row, column, and total number as well. Then click on continue. Now, no need to change any other things. Then directly click on OK. Now, this is the table what we are getting in our hands. Now, the first thing what we are having is the case and control. So, one is what case, two is what control. What about DM? One is yes, two is no. Correct? So, it is coming significant. See, chi-square is coming significant. How come? What is significant then? What is the p-value for significance? Anyone? What is the p-value for significance?
0.05 to
Less
0.29.
than, no, less than 0.05. I think you were getting confused between the kurtosis and the skewness and the p-value. So for the p-value, remember always less than 0.05 for the significance. That's it. Now here we are having case and control. Here we are having diabetic mellitus, yes and no. So it is coming significant. Now something is there. So we need to evaluate first of all. Now in the case group, we are getting 20 and 30. In the control, we are getting 10 and 40. Correct? So we can conclude that diabetic mellitus, one is yes. Okay. What about case and control? So the prevalence, the incidence, the number of patients are significantly more in the case group. How come? Because we are getting 20 number of patients in the case group who are having diabetic mellitus. What about the control part? Only 10 patients are there. So overall, we are getting 10 more patients in the case group. So we can conclude that what? The diabetic mellitus was significant factor that was linked with the case group. Or in the case group, significant relation is there with some diabetic mellitus. And we can report the same with what? A p-value. That is what? 0.029. That's it. Simple. Everyone?
Yes, sir.
Others? Do we have
Yes.
any doubt? Simple thing, no? So if you want to find the association or relation between two parameters that should be in the categorical format, you have to apply chi-square. If you have data in the continuous format, then of course we can't apply chi-square. For that, we have to apply t-test, but not chi-square. For chi-square, we need what? A categorical variables. And your expected count should be more than 5, not equal to or less than 5. Correct? So let me take one more example if where we can have expected count less than 5. Okay. Now in this portal hypertension, so one is what? Case, two is what? Control. PSN is what? Portal hypertension. One is yes, two is no. So in this part, expected count is coming 1.5. Now suppose this is one, this is second, this is third, and this is fourth. Total four blocks we are dealing with. So if any blocks out of four is having expected count less than 5, you have to take what? A Chi-Fisher test, but not chi-square test. Now here, suppose this is what? 48.5. Suppose this is 15. This 1.5 is 15. This is again 48.5 and this is 1.5. So even though you are getting only one expected count less than 5, you have to take what? Chi-Fisher test, not chi-square. Correct? Now, in the below table, we have to ignore what appears in chi-square. We need to look for the Fisher exact test or Chi-Fisher exact test. This is what it is, Fisher exact test, and we need to take what? 1.000. We are not taking one tail, we are taking two tail. This thing, two-sided. That is what 1.000. So can anyone answer me what is the difference between this two part, this first and second part? What do people really understand by two tail or one tail? Anyone? Can someone answer? Anyone? Anushka? Dhruv? Anyone? What do people really understand by these two terms? In this table, we are getting two p-values, right? Here we are having two p-values for the one and one for the two-sided. That is 1.00 and one is 0.500. So why we are taking 1.00, not 0.50? Anyone? Maggie, Manu, anyone? Pooja, Rajendra Pratap, anyone?
Sir, I suppose because this stays as significant for both yes and no parts.
No. See, the thing is, if I'm telling that in this class we are having boys and girls. So suppose if I'm telling in my statement that in the main exam, girls will going to perform much better than boys. Correct? Now, in my question only, I'm having one statement that girls will going to perform much better than boys. So for that part, we will take what? One tail. This part, 0.500, because I'm making the statement in starting only that girl will perform much better than boys in the main examination. Now, if I'm asking you, suppose in this class, let's see who will perform much better. It might be boys, it might be girls. So for that part, we have to use what? The two tail part. So if you are making the statement that boys will perform much better than girls or vice versa, use one tail. If you are performing the experiment, not sure like whether girls are good or boys are good. So for that part, you have to find out what? A two-tail p-value. Done, everyone?
Yes, sir.
So I hope this question is done now. Where to use one tail, two tail. Correct. Now here what we are having 1.5, that is less than 5. So what we can do now, we have to ignore the p-value of chi-square, that is Pearson chi-square, two tail 0.558. We have to ignore this part and we have to focus on what? A two tail of Fisher exact test. That is what? 1.000. Simple. So this is how you have to perform the chi-square. Always focus on the data that is in the categorical format plus your expected count should be more than 5. If it is less than 5, then we have to use what? A Kai-Fisher test. Simple. Done, everyone? Done?
Yes, sir.
Okay. So the next thing what we are having is the one-way ANOVA. So for the one-way ANOVA, we need to open the new file. That is, go to open, click on data. Sorry, not this part. Click on file, click on new, click on data. Done. So this is my fresh sheet to work upon. Now we need to import the working data into the SPSS. So click on file, click on open, click on data. Now go to your main data source, change to Excel part, and open this employee data SAV file. Everyone, please open this employee data.sav file. Done, everyone? All done?
Done, sir.
Done, others?
Yes, sir.
Okay. Now, suppose, remember for the t-test, whether we are doing pair t-test or unpaired t-test, we need to look for the data that is only about two variables, not more than two variables. So suppose you are having variable that is more than two. I think in this class only someone has asked about the HPA1C level, like we are having three variables for HPA1C. So can we apply t-test? So answer is no. So for such variables, we need to apply what? One-way ANOVA. So one-way ANOVA is the advanced version of what? A t-test in which we can take more than two variables. It can be three, it can be four. Correct? Now, suppose in this part, we are having job category that is three, we are having one, and we are having two also. Now, in this job category, we are having three individuals. That is what? Two, one, and three. Now, suppose one is what? Clerk, two is what? Suppose we can take faculties, third is what? We can take, suppose, HOD. Correct. Now, if someone asks me, this is their salary. Okay. So if someone asks me, answer me which category is drawing much amount of money per month, whether this is clerk, faculty, or the HODs or the principal. So how to find this part? So we have to apply one-way ANOVA. So one-way ANOVA we need to apply once you are having data, one data in the categorical format, one data in the continuous format. So how to apply one-way ANOVA? So let's see. Now my question is very simple. You are having three categories, that is clerk, faculty, and the HODs. Which one is drawing much amount, more amount of money per month from the college? So what to do now? Go to analyze. Can you all follow me? Go
Yes,
to
sir.
analyze, then click on compare means, then click on one-way ANOVA. Steps are very simple. Click on analyze, compare mean, one-way ANOVA. Done, everyone? Done, everyone?
Yes, sir.
Okay. Now I will take my job category into the factor, and I will take the salary into the depending list, because job category is not dependent on the salary, because your money will depend upon your position. Correct? Now what to do next part? Go to contrast, nothing to change. Go to post hoc. As such, we will do nothing for now. Go to option, click on descriptive. Click on this third option as well. Okay, because this will give you what? A Levine test. If you can recall the t-test, we were dealing with a Levine test, correct? So it was giving you the variation, whether variance is there or not. So that's why we need to check for ANOVA as well. So ANOVA will give you p-value, but you need to take up the Levine test first of all, correct? Click this part, click on continue. Now click on OK. Now this will give me what? A one big table. Okay. Now, this is what your categories, that is what one, two, three, correct? Number of patients or number of individuals in each category. Suppose one is what clerk, two is what faculty, third is what suppose we are having HODs, correct? Now, what about their mean salary? Now, clerks are getting how much? 27,000 plus minus 7,000. We are getting this part to report. What about the faculty parts? We are getting around 30,000 plus minus 21,000. Correct. What about the HODs? They're getting around 63,000 plus minus what? 18,000. Okay. Correct. This is what you can report. What about the p value? So p value is here. ANOVA test. Correct. It is coming significant. That is 0.000. It indicates that something is there. Something significance is there for sure. No doubt. So we do have some significant difference among the salary drawn by the individuals per month by the college people. Okay. Now suppose I want to find out which category is drawing much more compared to the other one. Correct. Now, so what we can do now? We need to apply the post hoc analysis. So post hoc, what it will give us? It will give us the comparison between all the groups. Now it will compare faculty with HOD with clerk. It will compare HOD with faculty and clerk and all the way. Correct? So here we are having three groups, that is HOD, faculty and clerk. So it will going to compare all these three by itself only. Okay, so let me make it more simple. Suppose in this class we are having Yashvi, we are having Mohammad Noor, and we are having Maggie. So these three people scored a very significant marks. So suppose in your college I come as the job giving person and I wanted only one person, but not all three. So in the interview, in the exam, Mohammad Noor, Yashvi, and Maggie scored a significant good marks as per the ANOVA test. But I want only one person. I don't want all three persons. Suppose I just want one, not three. So what we can do, we can apply ANOVA test and we can apply the post hoc analysis. So post hoc will tell me among these three individuals, that is Maggie, Mohammad Noor, and the Yashvi, which one scored much better. Correct? Then I can take that individual into my company. That's it. So how to find that post hoc analysis? So once you are done with the one way ANOVA, we know that something is coming significant. That is what your 0.000. We need to apply what? A one way ANOVA now. So how to apply it? Go to analyze, go to compare mean, go to one way ANOVA. All done. Nothing to change as such of now. So what we can do, click on post hoc analysis. Remember, there is a role of this Levine test for this part as well. Can you all appreciate the presence of equal variance assumed, equal variance not assumed? Yes or no?
Yes, sir.
Yes. What if your Levine test is significant? Here we can see that your Levine test is coming significant. How come? What is the p-value now for Levine test? Anyone? What is the p-value for Levine test now?
0.0.
0.000. Correct. That means what? Levine test is what?
Significant.
Significance.
Significant. So what we have to take now? Among these two variables, equal variance assumed, not assumed, what we have to take now?
Assumed.
What? Assumed?
Assumed.
No. We will take
Equal
not
variant
assumed.
not.
Equal variance, not assumed. Remember, a rule is very simple. If Levine test is significant, we have to take equal variance, not assumed. Now, I will not make it too difficult for you all people. Remember, for the equal variance assumed, always blindly go with the Tucky test. Why Tucky test? Because Tucky test do not respect the type 1 and type 2 error. It will completely remove type 1, type 2 error from the data analysis. That's why we use what? Tucky test. But if you are having data that is not equally distributed, that time we are not getting such options. So for the data that is not equally distributed, we have to apply what? A Bonferroni test. Can you all see this part? Number second, Bonferroni test. Can you all appreciate this part? Bonferroni.
Yes,
Sir.
sir.
Okay, so for data that is not equally distributed, automatically Bonferroni will going to come up. But for data that is equally distributed, we always have to take Tucky test. So I will remove Bonferroni. What about Levine test? Coming significance. Of course, we can't take equal variance assumed. So what we have to take? Equal variance not assumed. So for blindly, take what? Games Howell test. Why? Because it will remove type 1, type 2 error from data analysis. So what we can do? Just blindly click on Games Howell test. Now click on continue, remove this Tucky because our Levine test is significant. Remove Tucky test. Click on continue, click on OK. Now sorry, post hoc we got. Okay, just give me a minute. Some mistake I have done. Compare mean, one way ANOVA. Post hoc done. Levine test continue. Options, mean plot. I don't want. Okay, okay. So here we have the table with us. Now, significance is there. Okay, fine. Now, this is what a job category. This is what a job category. So what we are doing now, we are comparing clerk with the faculties, clerk with the HODs. You can make anything. One is what clerk, two is what faculty, three is what HOD. So what we are doing, we are comparing what clerk with faculty, clerk with the HOD. Then we are comparing what faculty with the clerk and with the HODs. Then we are comparing what HODs with clerk and the faculty. Simple till now. Everyone, simple,
Yes, sir.
done. Now, if I tell you, tell me how much money clerk is drawing with respect to the faculty part. So what we can take, we compare 1 and 2. It is what in negative, negative 3000. So what we can report that clerk are getting less amount compared to the faculty, but how much? 3000. Correct? What about the HOD? If I'm comparing 1 with the 3, so what we can report? See the sign, it is negative. So I can report what? Around 36,000 rupees HODs are getting more than clerk. How come? Because it is coming negative for the clerk part. So negative means what? That 36,000 rupees are less compared to the HOD drawn by the clerk people. Correct? Simple now.
Yes, sir.
So do we have any confusion, any doubts? Anyone? Any doubts, any questions for me?
Sir, just the last step to uh, get this post hoc test. We
Post
have to
office.
click on,
Yes,
yes,
click
we
on
have to click
analyze.
on which category for non.
Okay, so click on analyze. Done. Then click on compare mean. Click on one way ANOVA. Done.
Mhm.
As we are doing post hoc, click on post hoc. Can you see post hoc now?
Yes,
Correct. Now look at the Levine test. This is what significance. That means equal variance not assumed. Blindly click on what a Games Howell test. If it
okay,
is
sir.
not, then click on blindly on Tucky test. But here
Mhm.
we know that our p-value is significant for the Levine test. We have to take what equal variance not assumed, then remove Tucky test. Click on Games Howell test, click on continue, then click on OK. You will get these four tables in your hand. Correct? So one is what? The mean values for each and every category. 1, 2, 3, and their mean plus minus ST. We are getting automatically, right? What about the ANOVA? What about the p-value for ANOVA? It is significant. That is 0.000. That means something is significant when we are comparing all these three variables. Correct? Now, if I want to check which category is drawing much more amount of money compared to the others, we have to apply post hoc analysis. Remember the simple trick. Mohammed, Noor, Maggie, and the Yashvi came to my interview, all scored better compared to the other class. No, but I want only one individual. So I will apply what? A post hoc analysis. So it will give me a quick uh, comparison between these three people, like which one is much better with the help of what? A post hoc analysis. Now, this is what a clerk, two is what faculty, three is what HOD. So if I ask you how much money less is drawn by the clerk when compared to the faculty, so what is the answer? Around 3,000 rupees. What about the HODs? So HODs are drawing much more amount than the clerk. How much? 36,000 rupees. Correct? Correct, everyone? What about the
Yes, sir.
faculty part? If we are comparing faculty with the clerk, how much faculties are getting more than clerk? 3,000 rupees. What about HOD? So if I'm comparing faculty with the HOD, I can like openly says uh, that HODs are drawing 33,000 rupees extra when compared to the faculty positions. Correct. What about the faculty HOD positions when we are comparing with the clerk and the faculty position? So HODs are drawing around 36,000 rupees extra when compared to the clerk. What about the faculties and the HODs? So I can say that I can say that HODs are drawing 33,000 rupees extra from the faculty position. Correct. What about the p-values now? It is coming significant for all. See, here we are having 6 p-values. 1, 2, 3, 4, 5, 6. So here we are getting 6 p-values because we are comparing each and every variable, faculty, then clerk, faculty and HOD. The same we are doing for the clerk part as well. Clerk with faculties, clerk with HODs. The same we are doing with HODs also. HOD with clerk and HOD with faculty part. Done. So this is how you have to apply one-way ANOVA. Done, Avi?
Hi, hi. Couple of points like I wanted to ask. One is you told regarding Bonferroni. So can you just tell it again when Bonferroni is used? And one more thing, like this class sheet in which you are applying ANOVA, did you share it in the group because I'm not finding it?
Ah, okay. What about others? Okay, so let me check. Let me check, bro. Let me check.
Yeah.
Okay, one sample, paired sample, and statistical analysis there. Okay, so give me a couple of minutes. I will share the same with you all. So how come
Yeah.
people, like someone replied, no, that we are opening now. Okay, that is for the different test. Okay, no issue. I will share. Just give me a minute. I
Yeah,
will.
yeah, no problem. Yeah.
In the meantime, I think you have asked for that Bonferroni test, right? So the
Yeah.
problem is, Tucky test will not entertain the type 1 and type 2 error. Correct. So for the data analysis, we always try to avoid what your type 1 and type 2 errors. So Tucky test will always remove this all the test. But in the case of data which is not equally distributed, there automatically it will come up Bonferroni test because there we are not getting the Tucky test because of course if data is not equally distributed, some problem will be there in the end. So also I have seen many people who will try to manage the data. I will not take the name, but someone from the Delhi have consulted me and they were
Okay.
asking that my data is not equally distributed. So we are trying to make it equally distributed. I'm not
Okay.
sure how they were doing, but it is not actually possible to make data that is again that is not equally distributed. So don't try to play with data. It will just destroy your entire things. So this is my tip for you all. If data is not equally distributed, then there's no need to worry. We can run our test with that part as well. Okay. So in the main employee data. Okay. Okay. So I have shared now. Please check your WhatsApp now, everyone. You
Yeah.
got
Thank
no?
you. Yeah. Yeah.
Okay. So no issue. Dhruv, we can run the test again. No issue. So
No,
in
no,
the
I got it. I can like run it in parallel. You can continue.
okay, fine, fine. Others?
Yeah.
But I've been running it on the data that I had already, other than the one we have provided. So
Yeah, but you can't know because that is different. So in the meantime, you open this sheet in your SPSS, then we can practice once again. No issue with me. We can help, like we can practice.
sure, sir.
All done, everyone? All done? Anyone?
So if we want to run a normality testing here,
Mhm.
so in that also in the factor list we need to put
Take the
the
variables,
job
what you want to
category
check. No,
and
wait. For that part, we are running the K.Wallis test. So for data that is not equally distributed for the one-way ANOVA, we have to apply what a K.Wallis test. So
No, no,
once
I am
this part is
asking
done,
like
no. Uh-huh.
if we need to check for the normality whether the test is normal, like for Shapiro-Wilk test if we want to run it. So
Mhm.
for that, we have to put the job category in the factor list and the salary in the dependent list, right? And then plots में normality plots will take, and then we'll get the normality testing like that only, like you explained it previously, right?
Yes.
Okay.
So if you have like aware of the Jamovi software, if you know how to use it, I'm not think that you might be knowing about Jamovi,
Yeah, yeah. I
but
don't know. Yeah.
for Jamovi, there is like direct options are coming up for data for the data normality and the other test. But
Okay.
SPSS will not allow us to run all things in one shot. But in Jamovi, we can do all things in one shot, like what you are telling in that way.
Okay.
But for SPSS, we need to run it like entire test one by one, one by one. So
Okay.
after this SPSS, then we can launch Jamovi as well, no issue. So
Yeah, I
for the one,
wanted to test the Shapiro-Wilk test for this data. Yeah.
yes,
Done,
yes.
done. Okay.
So the first thing what we will do is like remember do one thing also, like the data whatever you are running for the analysis, check the Shipro will test for that part only. Now suppose you are having around 10 variables to check, and
Yeah.
you're getting suppose around 5 to be like significant for Shipro and 5 non-significant for Shipro. Then what?
Yeah. Yeah, correct. Yeah, I don't know what to do then.
Don't know, right? So
Yeah.
if you are having data that is 50%, or what we take is like 40% during my consultation, I follow around 40%. So if
Okay.
data is like 40% is not normally distributed, but 60 like it is there. So I blindly go with what a non-parametric test. Correct. Now, suppose I'm running only two variables now to check whether it is like there or not. So if both second like two pair variables are not significant for the Shipro, then directly go for what parametric test in that part. So make a rule for your practice. If you are practicing statistics,
Yeah.
50-50 rule. If your data is 50% significant for Shipro, 50% not significant for Shipro, apply non-parametric test.
Okay.
Done?
Okay. So if it is more than 50% not significant for Shapiro, then we can go for parametric.
Sorry, what?
If the data as per Shapiro will test more than 50%, if it is not significant as per Shapiro, then we can go for parametric.
Parametric, yes.
Fine,
So
fine.
follow
ठीक
this
है.
50-50 rule. Okay.
Yeah.
So Dhruv, like what you are doing currently now?
Yeah, I am a senior resident in pharmacology in AIMS Bathinda.
Oh, okay, okay, fine, fine, fine.
Yeah.
Okay, okay, Dhruv. Okay, so what we can do next now? How to find the one way ANOVA now for this data? I hope that all parts are clear now. So like let's take a quick revision now. Go to analyze, go to descriptive, go to cross steps. Then sorry, not cross steps. Analyze, compare means one way ANOVA. Simple steps. So can someone answer me why we have taken in the dependent part we have taken the salary, not the job categories? Anyone? Anyone can answer this question? Mohammed Noor,
After continuing, Peter.
Dhruv, can you answer this part?
Yeah, because salary is dependent upon the job category. That
Yes,
is
that's
why.
why we are taking. True, so true. The next thing is what? Contrast. You can ignore as such of now for the post hoc. Check for the Levine test. If it is not there, then blindly take for the Tucky test and take the game solver test. But remove Tucky as such of now. Click on continue. Go to option. Click on descriptive. Click on variance test. That is fine. Click on continue and click on OK. So we are getting around 4 tables in our hand. Correct. Now this is your mean value plus minus ST for all the job categories. It is coming significant. That means something is there. Something means something significant. Some like factors are there. So what we can do now, if someone asks, answer me which category is earning more money with some p-value, then apply for the post hoc analysis. Correct. Now, after the post hoc, we're getting what? A game solver test. Why game solver? Because our Levine test is significant. So we have taken what? Equal variance not assumed. Done, everyone? So here we are having what? A mean value. This negative sign indicate that this number second is drawing, sorry, this number one is drawing that much lesser amount. Correct? If we are comparing 1 to 2, suppose 1 is clerk, 2 is faculty. So we can tell that clerk is earning less amount compared to faculty. How much? 3,000 rupees. Why? Because Look at this sign, it is negative sign. What about the HODs now? Of course, earning more amount of money, it is what? Plus plus for both the ends. Now, if I want to report with the p-value, so this is your entire, we are getting p-values. So in the initial phase, you were getting one p-value. Now we are comparing each and every category. So we are getting what? Six different p-values. 1, 2, 3, 4, 5, 6. So this is how you can report the one-way ANOVA and the post hoc analysis. Done, everyone? Now the same thing we can run. Now suppose this data is not equally distributed, we are getting Shipro will test significant, correct? So what we can do now, we have to apply K.Wallis test. Now if you can recall the last class on Wednesday, the last class, you can remember all those steps what we have done, correct? So what we can do now for the K.Wallis test, go to the analyze, go to the non-parametric test, then go to the second option, correct? Click on the second option, go to your field part, select the job category first of all, into the groups. Done. First step done. Second step is what? Go to salary, shift to test variables. Second part is done. Now the settings. If you can remember, when Whitney you test, Kolmogorov test, and the randomness test, ignore as such of now. Directly click on what? A Kruskal-Wallis test, one way ANOVA. Now we are getting one more activated parameter now. As soon as I click on this part, we are getting multiple comparison activated. Now in this part, we're getting what? All pairwise. Do not change to any other option. All pairwise will allow you to run the post hoc analysis, correct? Because in this part, we are not getting other options like the one way ANOVA to select the one like post hoc. But in the non-parametric test, do not change the all pairwise to any other option. Let it be. Just come to setting part, click on customize, click on Kruskal-Wallis one way ANOVA test. That's it. No need to change any other parameters. Then click on run. Now once done, it is processing. Okay. Okay. It is coming significant now. Here. Done. So you can take all these values, whatever we were getting, and you can take this p value and report in the method section that we have used what? K.Wallis test. So this is how you have to perform this part. Simple, everyone. So how many of you think like non-parametric tests are very easy to perform compared to the like parametric test? Anyone? Anyone? Okay, so let's take one more question. Suppose I need to find the data normality for the salary. So how to find it? Can someone guide me? How to find that part? Anyone? Anyone? If I want to find the data normality for the salary part, so how to do it? Anyone?
Yeah, you can go to analyze, descriptive,
Okay, okay, okay.
explore,
Analyze,
yeah,
descriptive, then
descriptive, explore. You
explore.
can go. Yeah, I'll just do it side by side. Okay, descriptive, explore. Then we need to go to we need to check the salary in the dependent list,
Next.
and then job category in the factor list. Go
No
to
need,
plots.
no need, no, because we are
No
dealing
need.
with
Okay,
data normality. No, it is not the
okay,
chi-square. No.
yeah, okay,
So go
okay.
to
Then go
statistics.
to okay,
Nothing
yeah.
to change. Next plot.
Plots may we have to take the normality plots and then run it. Yeah,
Run
continue
it.
and run it. Yeah.
Okay. 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 Done. Okay. So it is what?
Yeah, it is significant. So we need to use the non-parametric test.
Non-parametric test. So
Yeah,
we are like not using the one way ANOVA. So which test we
yeah.
have to use?
We the Kruskal values test we have to use.
Strawberry test. Perfect. So this is how you have to perform the one way ANOVA, chi-square, and the K.Wallis test. Done, everyone? Okay.
So
So,
here we no need to use it via group, right? We can just whether there are any number of groups, we need to just put the like here we are putting the salary in the dependent list. So only that we can check the normality, like we did it here, right?
Yes, that's what. So any
Okay.
variable you are taking to check for some like relation or something, then you have to
Mhm.
apply directly those part into the variable part. That's it.
Okay.
Done, everyone. And do not forget, you have to report all this test name in the method section of the research paper. Otherwise, questions will come up. And suppose if later on you have reported that we have used non-parametric test, non-parametric test, so again they will raise some questions. So how come you have done all these things beforehand? Because sometimes what happens that p-value will change. So that part you should be like very careful while running all this test. So if you have confusion, you can consult the statistician, you can consult me also. I'm happy to help, but do not run the wrong statistics. I think Vijay has some question. Vijay, any question? No question? Okay, fine. No issue. Others? So do we have any doubts, any question now? No doubt? Let me open the chat box once, then I think we can wind up afterwards if there is no question. Okay, clear until not for K.Wallis, one way over test. No. I'm not catching you, Yashvi. What?
Yes, sir. Clear for one-way ANOVA and K-quality test.
All done, no?
Yes, sir.
Okay. Maggie, Mohammed Noor, anyone? Vijay, Anushka, Dimple, Anirudh, all done, no?
Yes, sir.
Then no? Okay, okay. Dhruv, do we have any questions now?
Yeah, no, thank you.
Okay, okay, then fine. Okay, then I think we can wind up if there is no more questions. So you can practice this three tests now as such, chi-square, one-way ANOVA, and the K.Wallis test. Okay, one last question. Why we have to use, like where we have to use chi-square? Anyone can answer? Anyone? Why we have to use chi-square? Anyone? Where we have to use chi-square? Anyone? Yashvi, Maggie, Dhruv, anyone?
Categorical data.
Category
Categorical,
and not
categorical is fine. That is the required thing. But where we have to use chi-square? So what we are actually checking with the chi-square?
relation between the two variables.
Two variables. And those two variables can be what?
One can be
Categorical
the
or
category
continuous?
and the other can be continuous data.
No, Yashvi, that is for the one-way ANOVA, not for the chi-square. For the chi-square, you are checking the relation, but those two variables should be what? A categorical format, not the continuous format.
Yes, sorry, sorry. Yes, category.
And what about the expected count less than 5? So what test we have to use?
Fisher.
Chi-Fisher test. Okay, done. Perfect, done. Okay, so I think we can wind up now. There's like no more questions now. Okay, thank you so much, everyone. We can wind up now.